Hello, and today we are talking platelet rich plasma or PRP, specifically for female pattern hair loss. We're going to talk what the heck is it? How does it work? What conditions does it treat? What's the procedure like? What's the aftercare like? How frequently should you get it? And does this actually work? So first, what is PRP? PRP stands for Platelet Rich Plasma. And what that is, it's a procedure where we collect your blood and then we centrifuge it down, basically separating the elements of your blood. And then on the very top, we have what's called the platelet poor plasma, which is basically just liquid. And then at the very bottom are those heavy red blood cells. And then in the middle, we have what's called platelet rich plasma, which is just liquid that's full of platelets. And that's what we inject into the skin. So how does it work? So let's say you have an injury to your hand and it's bleeding. The first things that rush to the area are the platelets, these yellow things. And the platelets are kind of like emergency responders, and they have a bunch of stuff in their kit that's ready to help the area grow. Because it has to rebuild a lot. It has to rebuild the skin. It has to rebuild vessels. It has to rebuild collagen. So these platelets are full of growth factors that help things grow. So what conditions does it treat? Well, PRP is used quite often. It's used especially in ortho injuries, or if you have arthritis. It can be helpful in chronic wounds. It can be helpful in dental procedures, like having a graft done. We use it all the time in dermatology. If you've heard of a vampire facial, that's basically PRP and microneedling. And what we're talking about today, hair loss. So what is the procedure actually like? Well, you go to your beautiful dermatologist's office and they will take your blood, and then we spin it down to separate those elements, and then we have the PRP, and that's what we inject into the scalp. As far as what the post-procedure instructions are like, you'll have a little discomfort, some redness, some swelling. Don't wash your hair for 24 hours or don't run a marathon right after you get it done, that kind of a thing. So frequency. Generally, we recommend 3 to 4 sessions about a month apart. Each session lasts about 60 minutes, so it's actually pretty quick. And finally, does PRP actually work? And the answer is yes. Question mark. Researchers looked at 6 different studies with 177 patients that got PRP, and they found that when they pooled all the results together, that PRP did result in an increased hair count. That's when we count the number of hairs per centimeter squared. There were 2 other similar studies that also looked at a bunch of different studies, pulled the data together, and they found that indeed it does increase the hair count, and they found it does an even greater job of increasing the hair count. So these researchers say that it does indeed work. What about women versus men? Like everything in life, PRP is better for men. Men experience an increase in diameter and the density of their hair, whereas women experience an increase in diameter of the hair. In general, when we pool all the data together. When we're trying to pool all data together, it is very complicated, and trying to compare studies is really tough. And you might ask why? Well, there are so many variables in PRP, and there's no one procedure or no one set of rules that everybody goes by. You go to different offices, they're going to have different protocols for how they do their PRP. For example, you can spin it down 1 time, you can spin it down 2 times. You can add a platelet activator, which basically activates the platelets to get the growth factors out, or you can just leave it as is. Also, the platelet count itself. Some people, just through no fault of their own, they just don't have as many platelets, and then the procedure doesn't work as well. Also, the treatment volume, how much you're injecting into the scalp, and treatment intervals. There's no one set way to do treatment intervals either, so not a lot of standardization. It's still pretty tough, but overall, PRP in general does work. So that's PRP. Thank you so much for watching.